Welcome back into Talking Fitchburg. Joining me today from the Department of Ag Trade Consumer Protection, got Lara back on the show here for 2021. Lara, how you doing out there today?
I'm good. Happy New Year, Jeremy. Thanks for having me.
Doing wonderful, doing wonderful. Glad you're here, and you're going to give us an update. We talked a little bit about the COVID vaccine being out there last month as things were getting kicked off. We want to make sure we stay up on it with the latest information. So we're going to talk a little bit more on that, any scams that are out there related to this, and for sure ensuring that the vaccine, you're signed up correctly, and you'll get the vaccine when you can get the vaccine. So first, if you could just tell us out there currently, there are scam reports out there related to the coronavirus and vaccines. What are you hearing so far? Anything here in Wisconsin?
So there's still concerns about COVID scams related to all kinds of government programming, right? So we have some new stimulus checks coming out, which means that the scammers are still going to be in that space. We'll talk a little bit about the vaccine scams. But again, with the loan forgiveness and student loans, with the eviction moratoriums, with the SBA, the small business loans, and the stimulus checks coming out again, you're going to see scammers. So we are just basically reminding folks to use trusted sources of information on all of these programs that are offered by the government. If you're getting unsolicited calls or texts or pop-ups in your social media, you should ignore those. If you think you're eligible for some of this relief, go to trusted sources of information. Go to the government's website on COVID. All of the information you need about student loans, about SBA loans, about stimulus checks are there. And that's where you should go. So just be very wary. We're still seeing reports on these scams, and we want people to avoid them.
Yeah, and they're coming. It's not just related or limited to Wisconsin. It's all over you. I see it from the Federal Trade and reports that they put out there as well. Talking specifically on the vaccine and specific scams there, what can we share to make sure that people are or know everything related to getting a vaccine is appropriate and not a scam?
Sure. So this is really where scammers are going to be super active, because people are desperate for information. They're feeling vulnerable. Their health is at stake. So they're looking for information. So there's certainly scams out there about fake health claims, promoting all kinds of unproven treatments, and they could have malicious attachments. They could steal your money, your identity, that kind of stuff. So again, there's some really great information on the government's website about the prioritization and the rollout of the vaccine. And that's where people should go to get that information. We're all excited about this new vaccine, but we're not all going to get it first. And each state is approaching this differently. I think that's another thing that's important for people to understand. There are some federal recommendations about the rollout, but each state has its own rollout and prioritization plan. So if you're talking to your loved ones in Tennessee or Florida, they're going to be doing it a little bit differently. And you need to go to information about Wisconsin's rollout, about Wisconsin's prioritization, and make sure it's information that you trust. So of course, ignore any online offers for vaccinations. Currently, the approved vaccines are in high demand and are in very limited quantities. And the federal government, the CDC, will oversee that dissemination. So this plan is currently focusing in Wisconsin on long-term care facilities and frontline healthcare workers who provide direct patient service and are at high risk to exposure for COVID-19. What we're recommending folks do is a couple of things. If they want trusted sources of information about their availability, their eligibility, you can first go to your health insurance website for FAQs or resources on the COVID-19 vaccination distribution if you have questions about your eligibility. A lot of healthcare providers have FAQs up, or they've already reached out to you. Many of us use MyChart to talk to our healthcare providers. I know I, for one, have heard from my healthcare provider. But again, if it's a pop up, it's in an email in a way that you're not familiar and it's unfamiliar to you, then don't respond to that email. Go to trusted sources of information for your healthcare provider, how you typically connect with them, and ask them information that way. Um, the other place you can go to is wisconsin.gov/COVID-19. There's going to be a lot of information that the government is putting out about how Wisconsin is disseminating this vaccine and the priorities that they're putting in place in Wisconsin. So that's your trusted sort of general information that you should look for. But just fact check any information that's coming across. Scammers, sometimes well-meaning people share information that hasn't been verified. So before you pass on any messages, make sure you're aware of the source of that information and it's something that you trust.
Yeah, one of the scams that we have heard is about getting on a list. There's these lists out there that you could get on, and once you're on the list, you're set to go. But oh wait, you got to pay to get on that list. The too good to be true offers out there definitely got to be a red flag. I'm suspecting.
That's right, Jeremy. Thanks for bringing that up. There are lists, but not ones that you can pay to get on, and they're being created right by the government based on who is eligible and how to keep our community safe. I mean, again, remember, there's a limited amount of vaccine at any one time. We're all going to be able to get it, but as it rolls out, the people who are most vulnerable and are most important to keep protected right now are the ones that the government is trying to identify. So who has that information? Wisconsin.gov/COVID-19. That's who has that information. And that's where you should go, or your healthcare provider, to find out information about you. And they will share it with you when they can.
Since there is so much high security surrounding the vaccine and scam and everything else in between, how close is DATCP, your section, consumer protection, working with the Department of Health Services in Wisconsin, and are working together to make sure that you're trying to I don't know what the right term here is, but stop the scam and make sure that this is all done legitly.
Yeah, so good question. We are tracking what DHS is doing regularly and in communication with them, and working to find the best way to disseminate this information so people don't fall prey to scammers. I mean, one of the challenging things about COVID in general is that the government is very active and they have a lot of programs, and they are contacting us where we are eligible for some of these programs. And so, for years, we are on your program saying, unsolicited calls from the government are probably scams. That it's rare that the government is picking up the phone and giving you a call. And it is still rare, but there are times in which we are going to be contacted when we, by a contact tracer, for instance. So it is challenging right now to get that message out to consumers. When they're being contacted legitimately and when they're not. And that's why we are telling folks that, as a general matter, you should go to trusted sources of information. You should initiate that contact. If you get an email that is unusual to you from your purported healthcare provider and you don't recognize it, don't answer it. Certainly don't click any links on it. And then, contact your healthcare provider individually to find out if that is a legitimate email. Also, just don't pay for any of this stuff. Right now, we're in a crisis that the government is providing these services for free, so you shouldn't be paying to get on a list. You shouldn't be paying for the vaccine. You shouldn't be paying to get some unverified, healthcare cure that doesn't actually exist. So those are obvious scams, but just be suspicious, and again, go to the information rather than reacting to something that's coming to you if you feel like it may not be correct.
Yeah, the tips on finding the direct source and talking about exactly going to the government site, specifically to COVID-19, and getting the facts straight certainly are important. And you hit it on the head here too, that you just, every day it's a battle. You got to keep up with it. You got to stay alert and visual be vigilant of what's going on out there, because scams happen, especially when it's this is a pandemic that we've never seen before to this measure. So it's been crazy out there. Lara, thank you so much for all the tips and your time as always. And thanks for coming and being with us again this year. Looking forward to sharing great tips from DATCP.
Thanks, Jeremy. Thanks for having me, and stay safe.
You as well. All right, I'll take a quick break. More to come. You're watching Talking Fitchburg.